Hello! Quick vid today about why some new babies will attempt to latch but then won't suck when they get there. When a new baby is born, they have reflexes, so they're involuntary, they're automatic, they can't help themselves. And one of those things is searching and rooting for the breast with their mouths. And another one is actually that their suck is actually a reflex. And the suck reflex is actually right at the back of the roof of the baby's mouth, right up there. So if the breast tissue is not getting far enough into the baby's mouth, it will not trigger the suck reflex. So you could have a baby that's rooting around really nicely, and then they're getting on, and then they're just sitting there and they're not really doing anything because actually that nipple is not far enough back up there to trigger off that suck reflex. Or they might go on, take a couple of sucks and then get frustrated and come off, or any combination of things. But if they're not going on and kind of not fairly consistently sucking with pauses, then it may well be that the nipple isn't far enough back. Now that's why it can prove difficult if you've got flat or inverted nipples, because if you think the baby's trying to get hold and trying to latch, but because nothing is kind of getting far enough back to trigger off that suck reflex, what we need to do is make sure that we can try and get some really good breast shaping going on so that the breast tissue does get far enough back to trigger that off. So it's not impossible with flat or inverted nipples at all, far from it. Lots of skin to skin time, lots of practice, lots of patience, skilled support to help you so that you know about how to shape your own individual anatomy in the best way for you and the best way for your baby. But actually, if you can manage to do that, then absolutely your baby will get it. You'll get it. Some people, where babies are really struggling to latch, will use a nipple shield, because that can bridge the gap a little bit between there, if you think, if they can't get hold very well. And then you've put the shield, which are quite long, can trigger off that sucking reflex. So that's why sometimes people will use a shield when the baby isn't latching very well with a flat nipple. But they do need to be used with caution, just so that you make sure the baby's getting enough milk. So make sure you seek out some support when you're doing that. I hope that's been helpful.